But again, the takeaway point here is a thorough exam is the key. The physicians typically will look in the mouth, they will examine the tonsils, they will examine the neck, they'll carefully palpate the neck, and they will notice any kind of abnormality. But the truth of the matter is that if you look at statistics and data, majority of head and neck cancers have been found by patients themselves. Patients will come to you and say, "Doc, something is off, something is not right, and this thing in my neck has been there for a little bit, and something is not making sense. My voice is a little off, my ear aches a little bit on one side." And another good point is that you don't have to be a smoker and a drinker, because the HPV is becoming more and more prevalent in head and neck cancers, and it is quite a problem. So that's where we are with that.
Yeah, I like this because I never smoked, I never drank, and I had, my cancer, happened because I was having problems with my hearing, and being I was in charge of such a big project at the time, I was getting headaches and felt like I had pressure in my ear, but I thought it was the stress of running such a big job until one day I was talking, and then the next thing I know, I was on my backside. My legs just gave out. That's when I called my wife and I said, "You got to get me a doctor, an ENT doctor." And I went to see Dr. Koifman, and he saved my life.
Wow.
And Sarah too.
And I think it's important, Anthony, like you said, when you feel something off, and like Dr. Koifman said, these patients are feeling something different. It's important for these patients to go to their primary care doctors. Not necessarily, you don't want to jump to the conclusion is, this is cancer. So we need to make sure that our primary doctors are really doing thorough exams. And then, if an antibiotic doesn't work, to get rid of it, that these primary doctors are then referring to an ENT or a dentist, or, somewhere where the patient can then get a biopsy and further workup.
Well, Sarah brings a great point. Patients need to be best advocates for themselves.
Yes. 100%.
If you feel that something is off, then you pursue it until you have an answer. If it's something in the neck and the doctor gets a CAT scan and it's normal, there's the answer. There's nothing there. But until you're satisfied with that answer, and until you can explain your symptoms, you should advocate, and you should see if it's not a primary care, your specialist, a subspecialist, but definitely get seen. And if you're smoking, stop smoking. There's help for that. We have programs at Garnet Health that will help you with that. We have emotional support groups, and Sarah, do you want to talk about that a little bit?
Sure. So Garnet Health definitely offers help with this to help stop smoking. They have the Freedom from Smoking classes, and it's a group class. It's sponsored by the American Lung Association, and I think their next class, I believe, starts in June. But it's good because you're not alone, and you're with other people that want to do the same thing that you can do, or that you want to do. So I really think that's nice that it's a group effort. And then as far as support with people that do already have cancer or have been diagnosed with head and neck cancer, I co-run a group for the oral head and neck cancer. And obviously with COVID, right now we're not meeting in person, but we do a Zoom meet. And as Anthony can say,
Yes, I can.
Yeah, we meet once a month, and it's really great that the patients are able to talk to each other. There's support for each other. They're able to talk about, what they've been through. If it's a new patient just starting, treatments, these other guys can kind of help them along. And then if it's other people that have already been through treatment and are still dealing with long-term side effects, it's nice when they can hear, yeah, I've been out of treatment for 2 years and I'm also dealing with this.
Yeah.
So it's a great connection for these patients to really be able to talk and feel the support.
I love my support group.
Mm.
It helps so much to hear
What
other
kind of
people.
cancer did you say you had? Was it brain cancer? or-
Me, no, I had nasal pharyngeal carcinoma.
Oh. Hmm.
Let me ask you guys something. Is there an age or specific population that's more prevalent or at risk for these cancers?
Again, we touched up on this a little bit before. The older patients who have been smokers in the past, who have used alcohol more than socially, are definitely at risk. And the risk of a head and neck cancer is additive. So when somebody smokes and they drink, if you combine their risk, it increases the risk of cancer 30 times.
But there's no more risk for a female over a male.
We've been seeing non-HPV cancers in older patients
Okay.
and HPV-related cancers in the younger patients. Again, non-smokers, non-drinkers, your blue-collar, white-collar type of the worker who is leading a relatively healthy life, but their cancers are related more to the exposure in the past. Just the risk factors are very, very similar to cervical cancers that are HPV related. And so to say that there's a specific age, it all depends on the cancer. Again, if you talk about laryngeal cancers, again, it's primarily smoking related. So we tend to see it in older patients. Tonsil cancer in the back of the tongue cancers, we see in about, I would say, mid 40s in general to about mid 60s. It's a lot more rare to see it at the later stage in life. Salivary gland cancers tend to occur more in older population than younger population. But we've seen cancers in really, really young patients. I think the youngest tongue cancer patient that I've seen was 19.
Wow.
And we've seen them in the mid 20s, we've seen them in the mid 30s, and we've seen them as far as 89, 90, 95-year-olds. But what we're discussing here today is more lining cancers. Most of the head and neck cancers are lining cancers, but we also see thyroid cancers, salivary gland cancers. We see lymphomas that present in an unusual way in the head and neck region. So the age in those diseases varies very, very widely.
So Dr. Alohu, from a primary care perspective, do you have anything that you'd like to add?
Well, I think it's important as we talk about like the signs and symptoms and also the treatment to also discuss how patients can prevent or try to prevent these different things, especially that's a big push in primary care. So in terms of when kids are young, be an advocate for the HPV vaccine. And if they don't want to get the HPV vaccine for whatever reason, definitely advocating for them to use protection, whether it's condoms, in any type of sexual encounter that they do have, making them realize that HPV is not only spread through sexual intercourse. When you think of sexual intercourse, it may be like vaginal, but also orally as well. And then being a big advocate in terms of really pushing patients to stop smoking and getting a thorough history so that if a patient does come in with certain symptoms, you can correlate it in terms of like family history as well.
Wow, great. So I have another question for the panel. I hate to bring this topic up, but it is obviously it's everywhere now. And COVID, right, has led to a lot of patients, maybe not going to their primary care visit as often as they should, or, you know, seeing their dentist twice a year like they should. What are, I know we kind of talked about some signs and symptoms, but is there like any sort of physical assessment that a patient could perform on themselves when, you know, thinking about this? Is there a certain way to palpate? Is there, you know, I don't know.
There's definitely patients tend to examine themselves willingly or unwillingly. A guy who shaves feels his neck. Someone can be in the shower and they can be washing their neck, or sometimes I have people come in and say, well, you know, I was just sort of passing by, scratching my neck. So a good proper exam will probably begin in the morning when you're in front of the mirror and you're brushing your teeth. Pay attention to cuts, discomfort. Look in your mouth. Get a flashlight if you would like to, and look around the teeth. Look around the tongue. Look behind the cheeks, and feel your neck. Come down the neck on one side. Come down the neck another side. Feel your own thyroid, and that would be a decent enough exam to perform on yourself. And again, stay in tune with your own body. If you feel something is off, get it checked.
Yeah, and I think it's really important, you know, that the public know that even with COVID, you know, these doctors' offices, these dentist offices are taking precautions to make sure that, you know, the patient is safe. And it's really important for them to go if they do feel something, not, you know, not to wait, because head and neck cancers can be curable, especially if they're found at, you know, an early stage. So to kind of delay things and make it worse, you know, is not a good outcome. So that, you know, if you feel something right away, you really should be going to primary care, your ENT, your dentist, you know, whoever you have to go to. These places are safe for patients to go to.
Yes, that's definitely been a challenge for us, you know, with a lot of patients that are coming in now. COVID's been around for a year now or so, or a little bit longer. And so they're getting back in the swing of things, if you will, getting their hygiene visits, getting things checked. And they've certainly had this tremendous fear. And so from the very beginning, we've been doing our best to put people at ease that it's safe to come to the office. I don't think there's less than 1% of patients that actually were contaminated in a dental office and got COVID in a dental office. It's like less than 1%. So we're very clean and cautious the whole time. So it's some of our challenge to try to get people to keep coming in. But as professionals, we see patients often with their every 6 month or twice a year. So we get to see them a lot. And so we're doing our best to screen them and to get them pointed in the right direction if we see anything that needs to be addressed, you know?
I like
Yeah,
to
I
say-
mean, there are also virtual visits available with a lot of practitioners. And if someone feels unsafe for one reason or another, there's always a virtual visit where a doctor can at least speak to the patient and maybe reassure the patient, let them know that the majority of offices are very safe right now. We're using the social distancing guidelines. And just like Dr. Littner said, the rate of transmission in offices is extremely low at the moment.
Well, that was a great point. You know, the telemedicine, the teledentistry, the technology today is just so amazing that, you know, they can take a picture of whatever they have a worry of and send it to the office. And I can look at it and help them figure things out in a positive way. And
Right. As long as you bring it to someone's attention, I guess this is what we're doing here. We're bringing this to the front and telling patients, again, if you feel something is off, don't wait. Just like Sarah said, if you present with an advanced stage cancer, your survival goes down to 50%. But a lot of these cancers are very curable in the earliest stages. And prolonging it, waiting, is really not beneficial. I know a lot of people are scared. I've heard people tell me I waited this long because I was too afraid of the diagnosis. But the reality is the diagnosis is not going to go away. It's
Right.
there to stay. So it's okay to be afraid. It's not.
Human nature
You're
is
not going to be.
sometimes
You're never going to be
tough.
shamed for being afraid. And if you're not afraid, there's a problem. Because, it's okay. It's absolutely fine, and we're here to help. We'll hold your hand. We'll guide you through the process, and make sure that things are done fast, proper. And another thing that I wanted to discuss is the majority of treatments for these cancers, multi-specialty approaches now. If you see just from this panel alone, we have a head and neck surgeon, we have a dentist, we have the head and neck cancer navigator, we have primary care, we have radiation oncology, medical oncology, palliative medicine, pain management,
Speech therapy,
speech therapy, rehabilitation services.
swallowing therapy.
Exactly. So each patient plan usually involves a lot of different disciplines that are trying to work together and put a comprehensive treatment plan for this patient.
Even hyperbaric oxygen therapy has come into being much more. I've dealt with patients who've wanted to have some dental implants, and they've had a history of head and neck cancer. And so what we did was put them in hyperbaric therapy for a certain length of time prior, and then they put the implants in, and then they had the hyperbaric oxygen therapy after, and there was good results with that. So that's another great thing.
Yeah, that's important because with the radiation, like when I was going to have dental work done, they had to find out like the amount of radiation because I would have to go sit in a hyperbaric chamber before they were able to do it. But it's very important after your treatments to continue to go to your dentist because you're going to have a lot of dry mouth and a lot of problems, dental problems afterwards.
Yeah, the dry mouth, the radiation therapy, it promotes decay, gum disease.
Long after it's done too.
Right. Yeah. Ill-fitting dentures, like Dr. Koipman was saying earlier, does create even more trouble and irritation, you know.
Yep.
I think we did touch on this a little bit, but we talked to, I think Dr. Koifman, you had mentioned how as soon as you express a sign or a symptom to your provider, be it a dentist, primary care, ENT, and allergy, there's CAT scans, I think you said, and biopsies.
Well, the workup is of course what we do is we try to get a very comprehensive history of when did it start, what were the symptoms, what are the potential exposures. Dr. Lippner touched on that before. What is the family history? There are very few circumstances where head and neck cancers will run in the family. It's fairly uncommon. And then a good physical exam. And of course, once the diagnosis of cancer is made by biopsies, imaging becomes very, very important. It's important for staging purposes. It's important for treatment purposes and the follow-up purposes. So imaging is pretty much a continuum that never leaves patients' care.
Right.
And then depending on the type of cancer, again, if you catch them early enough, you can treat them surgically, and which may spare someone significant radiation, significant of chemotherapy, and prevent some of the potential issues that Anthony and Dr. Littner were talking about, such as dryness, difficulties with swallowing, hoarseness, difficulty with opening the jaw, dental issues where the mouth gets so dry that the health, dental health is permanently affected and needs to be constantly watched. And then if the cancers are early or the cancers are excisable without any significant morbidity to the patient, then that's the approach that's taken. And if not, then the chemotherapy with or without radiation or radiation alone become primary options. But these are all very complex topics, and um, the decision about the treatment, of course, depends on what are we dealing with at that moment.
Right, it's individualized by patient. All right, so one other question I have, what are the survival rates of these cancers when detected early?
Early cancers do very well. Um, uh, they stage 1 cancers, and I'm going to be kind of grouping everything together. Their survival rates will range anywhere from mid-80s to high 90s. But once you start getting into more advanced cancers, stage 3 and stage 4, your survival is cut in half by default. So that's the issue.
Yeah. Wow. All right. Well, Anthony, are you up for sharing your story? How you I think you started sharing a little bit, but how you detected your cancer and what your experience has been?
Okay. Yeah. Well, I was working down at the Freedom Tower, and it was a big job. So I was experiencing headaches, some nosebleeds, and being that building is so big, riding those elevators, it was the pressure was building in my ear. And then once you get down to the lobby, you just go, and it would pop. Then it started waiting until I got to the train station. And then finally I had to go see an ENT because I felt like I had water in my ear and it just wouldn't come out. And then I went to go see Dr. Koifman, and I never forget sitting in his office. It was packed that day. And I'm texting my wife because I'm reading his bio up on the TV screen. And it says that he's a head and neck cancer and ENT. And I'm texting my wife, what'd you send me to this guy for? I don't have cancer. And when I went and saw him, and he goes, how old are you? I go, 47. He goes, you shouldn't have this much fluid. And lo and behold, but he had some poker face, boy. He had some poker face. He put me on some prednisone. It relieved the pressure, but we still had to go have a biopsy. And then he said, I'd give you a call in about a week or two. Called me 2 days later. I knew it was bad, but I'm still here. I'm still driving him nuts.
That's right. Wouldn't have it the other way.
And Sarah was one of the first nurses that I come across, and she was so comforting to me and my wife. I knew right then and there I was going to be okay. Like when I sat down with Sarah in Dr. Iannelli's office.
So you feel as though that it was the environmental factors that
Yeah, it's
contributed to
9/11
your
exposure to 9/11.
right?
It was I got that certified through that. It's a long process because I was young back then. I'm like, I never went and got checked. I'm like, I'm not looking. I wasn't right on the pile, but I was down there in that type of environment for months.
Mm,
And
yeah.
it took 15 years afterwards, 16 years afterwards before anything happened to me.
Wow.
Yeah.
Yeah, I
And
mean,
I think that's why your story is so
definitely
important to me,
Huh?
because you really point out that, you took this ear pressure, something that a lot
Right.
of people, especially, working in construction, you're up, down, maybe you have loss of hearing from all the noise that you were around, but you really stuck to your guns, you talked to your wife, you got there and you got worked up. And I think that's so important. That really pushes why patients really need to
They have to
go
be
right
on.
away. You have to
Yeah.
listen to your
What
symptoms.
what most people will find insignificant sometimes or oftentimes raises a big red flag with us. Something like ear pressure, or something like ear pain, or earache, or a minor swelling. Patients may just say, "Well, you know what? It's really not that important." But we have certain things that we follow and we believe in, and when we hear a 47-year-old gentleman comes in with hearing loss on one side with fluid, we know it's cancer until proven otherwise. You have to look. You have
Right,
to you have to look in the back of the nose. You have to make sure that there is nothing blocking that eustachian tube, and make sure that the fluid in the ear is not caused by an obstructive tumor in the back of the nose. So again, these are the things that a lot of people may consider to be trivial, but we don't treat them as trivial at all.
even like patients that are constantly biting their lip or biting their cheek or whatever, and it doesn't, let's say, heal, or if it's always like bleeding and it's not getting better, or you have to have these things looked at. you
Correct.
know?
Yeah, it's very important to know your own body, and you could tell when something is off, when something's not right with your own self. Go to a professional, get checked.
Right.
Good advice.
Anthony, from when you got diagnosed to remission, how long was it exactly?
I was diagnosed, I believe, like the end of December of 2014, and I started treatment the beginning of March, and I finished like in the middle of April of 2015.
So it was short.
Yeah, it was short. It was like every day. It was every day radiation, and once a week I would have a round of chemo. So that day was usually a lot longer than the other days with just radiation. But the
So-
best part about after radiation was when they used to do the I used to say they used to power wash your mouth. You sit there and they're like spraying it down and everything, and it's like it's it's hard to describe it, but when you're going through radiation on your head and neck, and it's just weird while you're laying in the machine. Like I was able to tell by sitting there strapped down that there was something was going wrong with the machine. That I told the technician, I think there's something wrong with the machine, and he's like, no, this machine has never broke down. The next day when I showed up for radiation, he goes, how the hell did you know that? I'm like, well, when you strap down there for 20 minutes every day, you start to all you're doing is listening to the machine, and you feel it go around your head. So he was like, he goes, that was amazing that you were able to tell me. He goes, it backed up the whole rest of the day after you left. I'm like, oh,
So-
sorry. I
so
tried to
let
tell
me
you to
ask
get it repaired.
Anthony, let me ask you a question. So were you seeing a dentist during this time?
Yes,
And what did they do for you?
absolutely nothing.
Hmm.
Oh,
I
no,
would not
who's
like
the
to tell
doctor?
you who they are, but yeah, Sarah knows those stories. But
And
afterwards,
that's why we send our patients before any treatment
Yes.
starts. We want to make sure they get to the dentist, they have a good oral exam, they get fluoride trays or a fluoride treatment to try to keep their teeth as healthy as possible
Yep, good
prior
point.
to the treatments. And then again, after the treatment. So
afterwards, it's
so
very
important
important.
to continue going to the dentist 3 months after treatment, 6 months after treatment, and then to continue, whatever your dentist tells you by yearly, like twice a year, or, whatever your dentist tells you. But it's really important to stay on top of that.
Yeah, I have to go a lot more than normal. Like every 3 to 4 months, I have to go in.
Well, that's the right recommendation for
Yes.
sure. For hygiene visits, meticulous oral hygiene, water pick,
Yeah,
fluoride trays, yeah, all of that.
I
We
have
have
it all.
there's different products on the market too that you can have salivary substitute like a biotine. There's oral balance, which is a saliva substitute. There's a lot of products out
Yes,
there
I
on the
tried
market.
quite a few of them.
Special cancer brushes that are very, 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 very soft that
So,
help so they don't like make it really feel rough and hard on your tissues. There's a lot that can be done.
yeah, there was one product that I found to work a lot better than the biotine. It was called Stella Life, and my dentist on record. It doesn't taste very well, but it worked as far as like with the saliva and
With the
everything.
getting moist, yeah.
Yes, it worked fantastic.
How do you spell that?
I think it was Stella.
Stella
And
Life?
Stella Life, yes. My hygienist recommended it for me, and I was able to purchase it online.
Perfect. All right, good.
And one thing we didn't touch on, after treatments, another program is the Orange Regional Rehab program. So, patients are having trouble, like Dr. Koifman said, opening their mouth after the treatments, or they're having swallowing difficulty still after the treatment.
Lymphedema clinics.
They go there and they're seen, they're evaluated. Lymphedema is another thing that we can see in these head and neck patients. So really comprehensive treatment all around, before, during, and after treatments.
And another point that I would like to make is that I already spoke about the multi-specialty approaches to head and neck cancer in general, but we are on staff at multiple different institutions, and we have access to large academic centers, large academic trials. We're constantly in contact with larger institutions, and anything that is very complicated, unusual, we are almost always in consultations with different services at different institutions. So basically that speaks to the access, because not everyone is able to travel to different places. And I think one of the issues with head and neck cancer patients, especially people who are living in underserved areas, people who don't have access to transportation, patients who don't or cannot afford to go to the doctors. We do have access to cancer screenings. Of course, with COVID, this has been an issue. But in terms of more complex and more difficult treatments that may not be available locally, as long as you get to us, then we can work much faster and much more efficiently to get you to the place where you need to be.
That's what the navigation services do too. When you refer patients over to us, Garnet Health has the navigation program, not only for head and neck, but for GI, for lung, and for breast. So when these patients are diagnosed, your doctor refers you to us, and we're there to help you to, be able to get you support services, help you with transportation, making sure you're getting the timely care that you need. If you need a referral somewhere, we're helping with that. So the navigation services really helps with that.
Yeah, so it looks like one of our participants sent us a message. Post-treatment, I learned how to do self-lymphatic neck massage to help with the swelling. I still do it daily along with my neck and jaw exercises. Sarah was great in helping me find solutions.
Good.
So
we love Sarah.
Sarah is great. We love having her a part of our team. But I think that we brought up a good point here. I don't think we talked about neck massages and the
Well,
swelling.
that's all part of the, Sarah mentioned that there's a physical therapy, there is lymphedema clinics. So patients lose range of motion. Sometimes they lose their shoulder range of motion, they can lose their neck range of motions, and they can have, unfortunately, complications such as neuropathy, where the nerves are not firing the way they should, but they can have pain. And these clinics that we have as part of this cancer program help you deal with that. The lymphedema clinic will teach the patients, and sometimes will even fashion them with a certain device that allows drainage from the head and neck areas. Because as you know, the radiation damages those outflows from the head and neck region. And whether you like it or not, head and neck is an appendage, just like an arm, just like a leg. So it's attached to the rest of the body by the neck. So if the neck has been radiated and the lymphatic outflow had been compromised, somehow it has to drain. And that's why a lot of head and neck patients will present with a lot of swelling, which is a benign swelling, but unfortunately swelling. Some of them will keep it for the rest of their lives. And like this patient just mentioned, some of them will be helped by drainage therapies and physical therapies, et cetera, et cetera.
Yeah. I go for
Very good.
physical therapy on my neck, and I also go for vestibular therapy also, because with the radiation and chemo, I had problems with my inner ear, and it tends to make me lose my balance.
Mhm.
So it's important to,
Yeah.
just get checked out as far as with that also.
Well, we all need help from others to get us through this, you know?
Yep.
Yeah, we all work together as a team. Really, it's a team effort, everybody.
Yeah. So we still have a couple minutes left. So while we're all chatting here, I'd like to, open it up to Q&A. And if there was anything we didn't address here, I welcome you guys to jump in.
Question and answers from the public you're talking about, or us?
Well, Q&A all around. I'm sure somebody has something for Anthony, or and the public will. I will monitor the Q&A box.
I think we've addressed it pretty well, unless somebody has any specific questions. It's a very broad topic,
Yeah.
and it's impossible to cover it in 1 hour. But as long as we bring in awareness to people that this problem exists, and what's also interesting about head and neck cancers, interesting in a negative way, is that this is probably one of the cancers that carries a significant amount of depression and anxiety and break of social bonds, because this is our face, this is our head, this is our eating, this is our talking, this is the way we communicate, this is the way we see. It is one of the less likely cancers, 4% of total, but the amount of dysfunction and morbidity that this cancer can bring to someone is quite significant. That's why it's really important to catch it early. The earlier you catch it, the less likely you are to suffer permanent issues, and the more likely you are to make it through.
Amen.
We have a very interesting question here. We actually have some appreciation. But the question is, my question's about my CPAP. I'm concerned that using it every night and having it dry my mouth out, etc., could lead to problems down the road. What should I do to help myself?
Well, I don't believe that we have any data to suggest that CPAP causes cancer. The CPAP is a machine that blows a certain amount of air at a certain pressure to help someone with obstructive sleep apnea. The machine usually comes with a humidifier. So it's important to make sure that the humidifier is properly adjusted and properly set, that the amount of moisture that's coming in helps the patient not to be overly dry. And if the pressure is still too high and very disruptive, then they need to cycle back with their prescribing physician, who may choose to adjust the pressure a little bit down at the cost of maybe having a little bit more apnea, but improved compliance. But that's really up to the individual practitioner at this point. But I would suggest just making sure that the CPAP is properly humidified. There's enough moisture in the air.
You can also have a humidifier in your bedroom. I recommend that with all my patients. I don't do CPAP, but I treat sleep apnea on selective patients with an oral appliance. And it's a nice potential alternative. Of course, CPAP is the gold standard, but in certain instances, using an oral appliance does help. And so they do complain about dryness as well. And I recommend a humidifier in the bedroom, and that does help.
Yeah.
Okay, well, there's another question. When you go to the dentist and they swab your cheek, what are they testing for?
They swab their cheek. Well, there's different ways to do a different oral cancer exams. They swab the cheek and they'll grab some epithelial cells off of your cheek lining. And then what they do is they send that to the lab, and then the squamous cells that are being removed, and other cells as well. And then they have a biopsy and analyze the tissue to see if it's potential cancer or not.
So they're testing for cancer.
Yeah.
Yeah, these are usually screening tests. But again, the key word is screening.
The screening, right?
It's a screening. It's not a definitive test. And if somebody still has a concern, even with a negative test, there are many different ways to biopsy. Of course, the fastest screening test would be to swab, to brush, to scrape. But then more definitive testing would be incisional biopsies or biters, et cetera, et cetera.
Wow. Okay, well, we have a couple minutes left. Does anybody have anything else that they'd like to add?
Before COVID, Garnet used to offer, different things like for cancer patients, like they had painting of your radiation mask or something like that. And they also had a trip to that Buddhist camp, I think it was, in Middletown. That was something really, nice to do. But, COVID kind of put a wrench into it, but we'll get back to it again soon. I missed the face-to-face interaction with my support group.
I think everybody does, but one of the big things, and I just want to thank Laura for getting this together, because usually Garnet Health does offer screenings throughout the year, different screenings for different types of cancer, and head and neck is one of the screenings that we usually hold. So to be able to do this virtually because of COVID, and to, you know, give the community some awareness and some things to give them to look for, to be able to be educated, to go with this information, I think is really great. So thank you for getting us all together.
Yes,
My
thank
pleasure,
you.
my
Thank you, Laura.
pleasure. Thank you all for your participation. Real quickly before we close our session, one message says, I'd like to thank everyone for saving my nephew Anthony's life. Now I know why he speaks so highly of everyone on this team. It's a very impressive group.
Thank you, Uncle George.
Thank you all for being a part of this. And then there is one other question. My primary care doesn't perform those swabs regularly. Should they be?
Not necessarily. Not every primary care does that. Your local dentists may offer that service because the dentists are usually they're the sentinels. They see the patients. They look into people's mouths all the time. They're very, very highly qualified to figure out what is normal, what is not normal. So they do these things in their office, and oral surgeons will do that, and otolaryngologists like me, ear, nose, and throat doctors, we do this in our offices. So these are the three different venues you can take to get your mouth looked at. And of course, you know, the primary cares, but they don't always do the tests. Alicia, is that, do you guys do any of that testing in the office?
No, not commonly. We usually defer that to the dentist to do.
Right.
Okay, well, I am going to share. If you're, oh, that is
This is Greek.
Greek. I don't know why.
Uncle George,
Let's see.
translate for us.
Let's
That's
try
Greek
again.
to me.
There we go.
There you go. This is English.
That's English there. Okay, so again, thank you to the panelists for taking your time this evening to talk about a kind of heavy topic, a loaded topic for sure. But April is Head and Neck Cancer Awareness Month, so we appreciate your time. And for any of our participants this evening that's looking for a primary care provider, a dentist, or an ENT and allergist, here is the contact information, and I will leave that up for you guys. Again, thank you so much for coming. And this presentation has been recorded, and it will be accessible on the Garnet Health website.